Hi, everybody. I'm Dr. Brian Ardis, host of the Dr. Ardis Show, and we're thrilled and honored to have you as a guest here. We have a very special edition of the Dr. Ardis Show. We're going to be talking about all the deceptions, literally, you find in dentistry. You've heard me talk about it a million times. From the time I started dating my wife, Jane, to having children, we've looked for what are called biological dentists to help us navigate healthier options when it comes to your oral and dental care. And the reason why I did that is because I remember being in acupuncture school and learning about the acupuncture principles and being shown charts of the teeth and how teeth are directly connected to various vital organs in the body. And the health of your teeth, the health of your gums literally has an impact on the health of the organs that your body anatomically is connected to. So there might be a tooth you have an issue with, a reoccurring infection, or you had a root canal in, and now you have liver failure, kidney failure, and what you never know is, and never knew, and your dentist never told you, or your oral surgeon never told you, was there's a direct connection to your mouth's oral health and the internal health of your body. And that when they did things in your mouth, that this downstream in months, weeks later would lead to chronic illness and symptoms. So that is what I learned years ago, over 25 years ago, before I ever got into practice using acupuncture, chiropractic, and nutrition. And so to help you learn more about the deceptions around dental and oral health care, we have a incredible guest in studio in my home who was shocked this was not in a building somewhere. All of the Dr. Ardis Show is filmed in my home. For all of you that don't know this, they just figured this out. They're all the way from Tampa, Florida, hanging out here in my home. This is Heather Paul, and she is in studio, and she's going to be teaching you about her new book she just wrote, who somebody you know wrote a foreword for, and you better read it. All right. The book is actually called The Great Deception. This is it. The Great Tooth Deception is what it's called. This is what it looks like. Oh, you'll see my name down here at the bottom. Look at it. Forward by Dr. Brian Ardis. All right. Here to discuss this book and to discuss her journey through learning as a hygienist in the dental industry, what she has learned. I cannot wait for this conversation. I think you're going to learn a lot because I've educated my wife, Jane, who I've known only for 15 years, been married for 10. She had to learn all of this stuff. Did you know that one of the first things we did when we started dating Heather was take her and get all of her silver fillings removed and her root canals taken out? I was
Awesome.
like, nope, I want you healthy, so we got to take this stuff out. All right, so here in studio, Heather Paul, the hygienist, known as Heather the Hygienist. Say hi to the audience.
Hey, so glad to be here. Thanks for having me, Dr. Ardis.
Well, now we're excited to have you here. So I want you to explain to the audience who you are, why you are, who you are, and why in the world do you care to write a book about tooth health, teeth health, dental, and oral health?
Goodness, well, that is definitely a loaded question. Sadly, here in America, we have 100 million Americans don't go to the dentist every year, nor do they even brush their teeth twice a day.
Hold up. Hold up. This is going to be the first question. All right. Why do so many people not want to go to the dentist? What are the most common things? What are the reasons?
Fear or finances are honestly the most common reasons. And I wrote a book to try and help educate people, empower them, because being a hygienist for so many years, I have just seen too many cases of bad dental work. And generally, people just don't understand how important their mouth is. And usually by the time they come and see us, it's kind of too late to do things. And they're in a position where now they don't know what to do. So I really want to empower people to be able to make better decisions for their health. And hopefully people will be able to take away the importance of their oral care. I mean, you have one tube, it starts here and it goes all the way out. But if you have disease in your mouth, you have systemic disease. So I hope people really start to understand and take that more seriously.
So what are the things people are afraid of that keep them from going to the dentist, number one? Because we want to absolve these fears, right? So that you can trust a dentist, hopefully in your area. And maybe we'll discuss that today too, is how do you find somebody you can trust to not do crappy things you discuss in the book that could have detrimental effects on their health? So what are the things that they're most afraid of? Some common things besides the financial part.
Yeah, besides finances, I think there's just so much fear, honestly, behind going to the dentist, the drills, the shots, and
That sound of the drill does suck.
drill. But people, I think, they see the white coat and then they panic. They don't know anything about teeth, and it really puts them in a position of having to just rely on their provider. and take their provider's word for it. But I really want to teach people that the standard of care in dentistry is not good for your health. So, you don't need to have a root canal done. You can have other options. So, I really hope people will start to investigate and be their own advocate and start to, look into things instead of just agreeing with whatever that treatment plan says.
Very good. All right. So let's dive into the Great Deception. You ready?
Yes.
What are some of the topics you wanted to make sure people understood in this book, which I have read? I would like you to discuss what are some of the myths, ideas, conceptions around dentistry and why so many Americans want to avoid it, and people around the world who don't even have access to it, many of them. But there are some real basic truths surrounding oral health. We'll dive into some of those great deceptions. Root canal being one of the biggest ones for me. I remember handing all my patients who would bring up the idea or tell me that someone's suggesting a root canal to them, and I'd go, just go online and download the root canal cover-up. That's exactly what I'd say. Just go download it and read it, and then you make up your own mind if you want to do that. I would never encourage anybody in my family to do that. And there's reasons for that, but you can go learn that yourself too. All right, so let's dive into, you became a hygienist. Did you know all of this information you just put into this book when you went through your schooling and education?
No, absolutely not. You are actually indoctrinated into the whole system. And I was taught in dental hygiene school that anyone who was against fluoride was actually a conspiracy theorist. So I, really recommended fluoride for over 10 years because I thought I was benefiting my patients. But it really wasn't until 2010 that I started looking at the ingredients of oral care products and was actually shocked to find out that the reason that they can put toxic products inside your oral care products is because it's actually in the same family as cosmetics. So that's why you can find things like paloxamir 407 and sodium saccharin, dyes that are banned in other countries but allowed here. But your mouth is the most vascular part of your whole body. So whatever you stick into your mouth gets into your bloodstream. And you don't need fluoride to have strong teeth. That is the number one myth, I would say, is that people think that they need to have fluoride to have strong, healthy teeth. And that is totally inaccurate because it disrupts the oral microbiome.
But I have benefited from drinking fluoridated water in every city I've lived in. Heather, the hygienist. So this is very much a conspiratorial topic. You may not want to share this with your dentist. It might freak them out. Just kidding. I've actually, since 2004, when I first moved to Maryville, Tennessee, went and met with the county commissioner and the public health director to actually have a lunch with them to only discuss we have to stop and not allow this action they're proposing in the city council to add fluoride to their water in 2004. Do you know I got stood up and then went to the health department to actually confront him, and he wouldn't even come out of his office because he didn't show up? It was all about fluoride and not getting in the water. This has been a big issue for me. Yeah. So true or false, fluoride in our water supply, which are you excited to hear RFK Jr. talking about all the fluoride bans in multiple cities around the country? Are you excited about that based on what you've learned?
I'm so happy. I actually wrote him a letter. I'm so happy. Yes. Fluoride, if it does any good at all, which I don't agree with, but it's really only for developing teeth. So that would be for children up to the age of 6. It's a drug. It's a mutagen. It's a halogen. I don't want to be drinking a drug unnecessarily. It reduces your IQ. It's a neurotoxin. It can cause cancer. I don't want to be drinking that. I don't want to eat chemicals. I don't want to drink them. I don't want to slather them on my skin or put them in my mouth. So, I want to have the choice of being able to put in my body what I deem necessary, not what the government deems is necessary.
All right. So do you know what the term dental fluorosis means? Okay. This is really funny, everybody. If you haven't looked this up, go on Google and type in dental fluorosis. Dental fluorosis. And when you look that up, you'll realize, oh my God, fluoride actually creates, it almost looks like a browning of your teeth, like you imagine black teeth with meth users. You got these brown stains and dental enamel loss from fluoride. And yet all of us are being told fluoride is great for you. It reduces the bacteria in your mouth. It will help you with less infections and improve your dental hygiene. No. Do you remember, everybody watching this? Maybe Heather remembers. Do you remember a time when your toothpaste, fluoridated toothpaste bottles and tubes used to have this warning? If you consume more than a pea size of this toothpaste, you swallow it, You need to call poison control. Do you remember these warnings on our toothpaste? That was all because of fluoride in your toothpaste. And then they decided to take it off your toothpaste tubes, include fluoride still in the ingredients, and then add it to your water supply and tell you it's good for you. They used to tell you, warning, call poison control. I remember these warnings on my different toothpaste when I was a kid. Aquafresh, all the beautiful little things. Oh, promoted to us by little cartoon characters like the Camel Cigarettes character that got banned, right? This is childhood, marketing and propaganda. We got to get that out of our stratosphere. No, they kept doing that as kids with a different poison called fluoride. So anyway, fluoride, you also agreed that is not ultimately great for our health to consume more of that. I mean, it's a known carcinogen. I don't know how many parents out there thought, I want children who develop juvenile cancer, so I'm going to give them fluoride-laced toothpaste and fluoride-laced water.
Well, it reduces their IQ too. So,
Oh, wait, talk about that. Wait, did anybody ever say, I want children that are dumber than me? I'm going to move to a city that has fluoride in their water, and we're going to only buy commercially available fluoride toothpaste. I don't know anybody that does it.
Well, I think the misconception is 97% of our teeth are made out of hydroxyapatite crystals. So what fluoride supposedly
Wait, say it again.
does,
slow it down.
97% hydroxyapatite crystals. That's what your teeth are made out of. So when you supposedly use fluoride, what it does is it binds with hydroxyapatite and makes what's called fluorapatite, but it makes it more brittle. So it's not bioidentical. There's no such thing as a fluoride deficiency on the face of the earth. It is not an essential nutrient. So you do not need fluoride for strong, healthy teeth. If you use what your body is what it already has, and that's hydroxyapatite in the form of nanohydroxyapatite, it's bioidentical to your enamel. So when you give your body what it needs, it always tries to heal itself. That's why I'm a huge proponent of nanohydroxyapatite and things that will help benefit your teeth and not destroy your oral microbiome. Everyone has an oral microbiome of both good and bad bacteria, about 800 different bacteria, but fluoride actually disrupts your oral microbiome. And a lot of people don't know this, but if you have titanium implants, it also causes corrosion of your implants. So it's definitely not something you want to be using.
Very good. All right. So you have a toothpaste sitting here that you developed. You might as well just show the audiences what it is in case you're wondering out there, what in the world am I going to purchase as an alternative to my Colgate, to my new Tom's from Maine's Colgate owned manipulated change toothpaste that I used to trust for years and don't use anymore at all since they purchased them. All right. Yeah. So show me yours.
Well, this is my spearmint. I have 3 toothpaste. I have a mint, a spearmint, and a cinnamon. And what's so great about it is it's the only toothpaste on the market that doubles as an oil pull. So the main ingredient is actually coconut oil, not water or some other crap, but actually coconut oil. So coconut oil is a wonderful anti-inflammatory. It really helps with reducing inflammation in the mouth. It can naturally whiten your teeth, but it's got hydroxyapatite in there, xylitol, baking soda, and so many people don't realize that you only have one coating of enamel. You will never regrow your enamel back, but you can remineralize enamel. If you're using toothpaste that's really, really abrasive, which anything over 70, by the way, is abrasive. Some of your whitening toothpaste are over 150 up to 200. And I think sandpaper has like a grit of 248. So you're using like liquid sandpaper on your teeth. You're really going to damage your enamel. And my toothpaste is a 31 and a 32 on the scale of abrasiveness. So it's great for veneers, crowns, sensitive teeth. But you definitely don't need to be using charcoals or clays. And in my book, Dentistry Made Easy, I have a whole list of things that you really want to make sure that you are avoiding so that you are not creating, more damage to your enamel.
Very good. It's called Simply Silver Spearmint. Where do they find it?
They can find it on my website, simplysilvermouthwash.com. It's on Amazon or Walmart online. HEB here in the Dallas area, I think, has it in like 63 stores. But it is definitely available, and hopefully people will ditch those toxins and just start making one small change at a time.
Very good. All right. Show me your mouthwash. It's sitting there too. So if you're walking through HEB in Texas,
this is my mouthwash. It is colloidal silver, which a lot of people may not be familiar with colloidal silver, but colloidal silver does not disrupt your oral microbiome. If you use an alcohol-based product, alcohol completely disrupts the oral microbiome. It creates dry mouth, actually cancer, and high blood pressure. So it's not something that you need. Actually, a lot of people don't know the story behind Listerine. Listerine was actually created as a floor cleaner, and then it was rebranded. But it was used to treat gonorrhea and dandruff. So you do not need to be using Listerine floor cleaner to clean your mouth with.
I guess they thought if it works for floors, it'll work for your mouth, weirdos. All right, good. It's like chemotherapy, right? No more mustard gas. We don't have any wars going on. Let's just take that same gas and convince people it's good for their cancer to help them live. Weird. All right. I don't get where we decided. It's just best to poison people and see if they get over it and consider it healthcare. So weird to me. Is that weird to you?
It is, because I don't think you can poison yourself to good health.
I mean, what about 1,4-dioxane? I just did this whole presentation on this. Did you know that this is a part of what was used in the chemical called Agent Orange? And do you know that this substance is in tons of our cosmetics? And this one substance is known that if a pregnant woman uses it, it will actually go into the fetus developing in the womb, will create multiple myriads of birth defects, but not just for the one child. If you've got this 1,4-dioxane chemical in your cosmetics and you're using it, it goes into your baby as a pregnant woman. It goes into your baby, creates birth defects, stillbirths, but it will actually, if the baby lives, they know it will actually impact the genetic construction, the congenital defects leading to birth defects for up to 4 generations if just the mom is exposed to this one ingredient that was a part of the Agent Orange chemical to destroy all of life in Vietnam in the Vietnam War. That's in your cosmetics. Mm-hmm. Why are there so many birth defects? Why does America have the lowest infant mortality rate of all industrialized nations? We can't keep babies alive up to 1 year old better than any other country in the world. We suck the most at that. All right. I don't understand why adding poisons to our life. Mm-hmm. I think just chemical industrialist, weapon designers, DARPA, whoever, I guess they decide if there's just an overage production of their poisons, they figure out how to get in our food supply, our cosmetics, our toothpaste, whatever it is, or mouthwash. Pretty ridiculous. All right. So if you want the alternative, hold them up. Hold both of them up. These are just 2 options for you. Be excited. Go find them. They're green and white labeling. You can find them. All right. Now hold up your books. Talk about the difference between these books.
Okay. So this one is really, it's for everybody. It is more of a handbook. I go into...
Wait, hold it up still.
Sorry. I have
title is Dentistry Made Easy. And where can they find that? They find it at HEB?
Amazon. Not yet. Not
at HEB, all of you.
At HEB.
Amazon, it's there.
Yes.
Very good.
Yeah, but this is a really great handbook. I've got lots of pictures of what good dentistry looks like, what bad dentistry looks like. I teach you tooth numbers and basically just helping you to be your own advocate, because I don't want you to be afraid at the dentist. And I think we tend to just think of the mouth as like a separate compartment, but it's not. That your entire body is connected. Like Dr. Ardis was saying, everything has a connection. So if you have an infection in your mouth, you have a systemic infection. We are so obsessed with clean eating and exercise, but like I said, 100 million Americans don't even brush their teeth twice a day, nor are they going to the dentist. And dental decay is actually the #1 disease in the world. So I wrote the book hoping that people would become more educated and feel more comfortable making the decisions that they need to make. And then I also wrote The Great Tooth Deception, which thank you so much to Dr. Ardis for writing the foreword. But, actually I was fired from 2 different jobs because I am so passionate about teaching people the truth. But, that actually bit me, and I got fired twice for doing that. But I got so tired of seeing the same thing happen over and over again. And that is, someone comes in, they have an infection, and the standard of care is you get a root canal, which, by the way, they're going to stick bleach in that tooth and stick it with gutta percha, seal it up, and say that you're good, that there's no longer any infection. But there's actually 75 different microtubules you have. You can never remove all that infection. So if that tooth lasts 8 years, it's considered successful, but I cannot tell you how many times in 30 years they fail. And they fail because your body is not meant to have something dead. I mean, this is like the only part of medicine that you actually leave something dead in your body. If a woman gave birth and didn't pass the placenta, she could die from an infection. You just cannot leave something dead in your body without consequences. And 100% of all root canal teeth have endotoxins in them. So it's a ticking time bomb. And I really, I hope people will take that more seriously. And you do have options. Again, I've written books to try and help guide you through that. So that way you don't feel like, you're going to walk around like one tooth Willie or something. You do have options. And I'm here to help you make the right choices.
I love it. All right. So a couple things. Let's address a few things that people may have questions about, because I always do. I had 5 kids, raised them. I'd like to know, you just mentioned it a second ago that most Americans don't even brush their teeth twice a day. Do you, as a dental hygienist, recommend brushing your teeth twice a day? Or is there another number?
I would say at least twice a day. Yes, you can overdo anything, but you want to use a good electric toothbrush, but at the gum line. People think that just brushing the surface of the teeth is enough. The way that I always tell people is this: your teeth poop, okay? 60% of the poop gets off.
Did you hear that? I've never heard that in my life. That's hilarious.
Yes, the brushing only gets off 60% of that poop. The rest is in the toilet bowl, and that is the space between your tooth and your gum.
You need to write a next book titled The Pooping Tooth. That's the name. That's what we're going to do. It's going to be a t-shirt. I want it.
Actually, I do have a t-shirt that says not flossing is like wiping your butt cheeks, but not your crack.
Oh, that was good. That was going to be my next question. Is flossing really that important? That visual makes it very clear. Exactly. That's probably important. Yep.
Only floss the teeth you want to keep. How's that?
Oh, there you go. Just the front one. If you only got one left.
Wait. Oh, goodness. So, basically you want to make sure you're brushing at the gum line with a good electric toothbrush for 2 minutes, but you have to be flossing properly. And I'm not talking about those little cheaters. Those little cheaters are taking that poop and they just keep moving it all around your mouth. It's like reusing toilet paper. That's gross, right? You want to get a nice long piece of floss and you want to use clean floss in between each tooth so you're not transferring that bacteria all around your mouth. Because again, that bacteria in your mouth gets into your heart and it can cause heart attacks, strokes, diabetes, pancreatic cancer, colorectal cancer, Alzheimer's, and dementia. And now, Dr. Ardis, we can do testing. So we can actually sample the saliva and send it off to a lab. And then the lab can send us back a report that says out of the 11 bacteria, you have 1, you have 2, you have all 11 bacteria, and we can treat that. I mean, wouldn't you want to know if you had like the bugs that cause Alzheimer's?
I think I want to know everything now that you said our teeth poop. Okay. Yeah. I want to know everything that they're pooping out in my mouth. All right. So, but however, it is true, right? We do need certain bacteria thriving in our mouth, right?
Yes, that's the oral microbiome.
So you don't just throw a whole bunch of antibiotics at it to wipe out everything, do you?
No, that's the key, is supporting your oral microbiome, because your mouth is your mini immune system, right? You got one tube, it starts here and it goes all the way out you. So this is where everything starts. It's your digestion. It's everything is going to start in your mouth. So you want to make sure that you're not wiping out your oral microbiome with alcohol or hydrogen peroxide or things that are too strong. You want that good balance. And that's what's so good about colloidal silver, is it's only going to kill the bad bugs and not the good. So it's going to help promote healthy flora in your mouth for sure.
That's a good point. I actually have had patients come in and I've seen some of the whitest teeth on earth from people from around the world, actually, that would fly in. And I would ask them, how'd you get your teeth so white? And they would tell me, I only brush my teeth with hydrogen peroxide.
Oh, gosh.
What do you say to that?
So hydrogen peroxide is like a broad spectrum antibiotic, right? It wipes everything out, and it is the ingredient in your whitening agents for sure. But too much of that, and it's going to damage your odontoblasts, which are the cells in your teeth, and that can cause extreme sensitivity. So you definitely don't want to be using that. Also, if you have silver or mercury fillings, because honestly, it's 50% mercury by weight, you're leaching that mercury into your bloodstream. So it's not safe.
Have you ever seen the videos where they actually take a person, have them drink a hot liquid like coffee, who have silver fillings or amalgam fillings in their mouth? Half mercury, half silver. When you swallow hot drinks, they will put these individuals in front of a green film, and you can see vapors of gas from mercury coming out of the mouth when the hot water liquid touches it.
Exactly.
And how many Americans drink coffee every day and have these silver fillings in their mouth, which is actually mercury. And then they also have them demonstrate by chewing gum. And with every bite friction on the actual filling, you will see this explosion of these mercury vapors, and you watch it actually come out of the mouth as the person chews and goes up their nostrils into their olfactory bulb, into their brain. Mm-hmm. Mercury is a known neurotoxin, everybody. Would you like dementia? Start chomping more on your silver fillings with your food and get that crap out of your mouth, man. It's ridiculous. Get it out. It doesn't belong there. It's never supposed to have been there. That's where the original quack phrase came anyway. Avoid the quackery, which is putting quicksilver in your mouth, called mercury. So,
but it's real important to teach people that they really need to see a mercury safe dentist and not just a mercury free dentist, because there is a difference. Most dentists don't really do mercury fillings anymore. We pretty much use composite resin, but a mercury safe dentist is going to have all the right protocols in place so that when they are drilling, they have the oxygen right there for you. They have a rubber dam. They have the special filters so that vapor that Dr. Ardis was just talking about isn't going directly into your mouth, because you're going to be more exposed to mercury while they're drilling it out than had you left it in there. So that's why you do want to see a mercury safe dentist to have them properly removed and detoxify yourself. Hopefully you can find a good biological dentist that will work with you on that. But, so many times I think people are struggling with brain frogs.
Yeah. Pooping teeth and brain frogs. Yep.
Fog.
You heard it here first on the Dr. Ardis Show.
30 this morning. Thank you very much. I do have a frog for a brain right now, but you definitely, you want to check to see if your mouth is really the main culprit. I think so many times doctors are not putting two and two together. Again, we have like this big chasm between, the medical profession and dental profession. We need to have cardiologists be asking their heart patients, hey, when was the last time you had your teeth cleaned? Are your gums bleeding? I mean, that's a sign of infection, but people think, oh, well, my gums have always bled. Well, that might be common, but that is not normal. If you washed your hands and your cuticles started to bleed, is that normal? No, it's not. So it's a sign and a symptom of disease. But we really need to start asking more questions and be proactive when it comes to that, because the problem might be coming from your mouth.
Are you sure if your gums are bleeding, that's not a floor cleaning deficiency and you need more Listerine in your mouth?
Well,
just kidding.
People will actually not floss or brush because they say, oh, well, every time I floss, my gums bleed. And that's the worst thing you can do. Flossing is like exercise. So the more you do it, the easier it gets and the better it feels. The worst thing you can do is not floss.
All right. So back to flossing, because you said something I thought was interesting. People actually recycle their floss? Or were you talking about that one little clip where they go between one tooth and the next tooth and they're just sharing the bugs from one gap to the other? Both. Yeah. All right. So talk about floss. What kind of floss should they use? Anything they should be warned about? Particular flosses besides the little one-handed clips?
The cheaters.
Well, there you go.
Anything that has Teflon, which Glide, I think, did just change their formula because they were Teflon, which has PFAs. So, you were exposing yourself to endocrine disruptors when you use Glide. So you definitely want to stay away from Teflon, but I think they reformulated. So that would be good. But a natural fiber, Dr. Tongue's, expandable floss, just definitely don't use those the little sticks. And the reason being is you have that toilet bowl, like I mentioned, the space is measured with a little ruler, and a healthy space would be like 1, 2, or 3 millimeters in depth. Those little cheater floss, they only go to maybe 1 or 2 millimeters in between the teeth. They don't really clean out that bowl. You need to get to the base of the bowl to clean properly. And if you're somebody that has gum disease and you have 5 and 6 millimeter pockets, you need to have a water pick, because floss is not going to access that far.
Oh, that was my next one. Actually, when you talk about flosses, water picks. Mm-hmm. My son was just told about a water pick the other day. My 13-year-old, you should start using a water pick maybe. And I was like, I've never used those, but are these measurements the only time you would actually know you should use a water pick versus flossing? Or is it a good general recommendation for all people to use a water pick versus flossing?
If someone is really prone to gum disease, you kind of have to use the extra aids. Or if you have braces or implants or bridges, they're very, very helpful. If you're somebody that tends to be more cavity prone, it's like you kind of fall into one of two categories. I feel bad if you fall into both, but usually you're either cavity prone or gum disease prone. Cavity prone people usually don't really have gum disease, but it seems like every time they turn around, every time they go to the dentist, there's a new cavity. That is because of the Streptococcus mutans bacteria. And the number one cause of cavities is actually dry mouth. So my spearmint mouthwash, this is really for people that have cavity problems. My mint and my cinnamon actually are more for people that have gum disease issues because it's got things in there like CoQ10 and myrrh, tea tree, and clove that specifically help with inflammation and bleeding, and also something called, I know it's a big word, raw croton lecellary sap, otherwise known as dragon's blood. But that is the sap from Peru's dragon tree. So if you were to like cut yourself and put the sap directly on the wound, it acts like a natural coagulant. So it's fantastic for people that tend to deal with the gum disease. But if you are somebody that has those 4s and 5s, you really do need to be using a water pick. But if you're somebody that typically has healthy gums, you're just more prone to cavities, then you don't have to. It's definitely a great aid, but I would say it's a must for people that have periodontal disease or gum disease.
Very good. Now, even before we go answering more questions of mine, because you're piquing my interest, that teeth poop. That's awesome. Just never heard that phrase in my life, and I will never forget. It's going to be awesome. All right. So for people who are going to be looking for a more mercury safe dentist, as you phrased it, what are ways in which people can at home start looking for people local to their areas online, which is where they're going to turn for a safer option for dentistry? What would you recommend people go? Do you have that like a health directory for dentistry on your website? Anything else?
What is it? IAOMT is a resource that they can go to. If you honestly just Google holistic or biological dentist in my area, there are certain, I think it's Holistic Dentist has their own database, but there's several that you can look into. But I would just do a Google search. Again, they're probably not on every corner. They're very, very hard to find, but I would encourage people to find the right provider, find someone who's going to listen to you. So many times there's what's called a cavitation site, which is just dead bone in the body that cannot be seen through dental x-rays. You actually need to have a cone beam. And that is something that usually your holistic dentists do have and are very familiar with using. So, you definitely want to make sure you do your research on who it is that you would be going to. Call, ask questions. Again, in my book, I tell you all the questions that you should be asking, things to look for. But sometimes, you know what? You might need to drive. And if it's your health and you're struggling, I mean, we have stories of people that had ALS that was being caused from root canals. So, that's very significant.
All right. So if they want to drive, where do they drive to? Tampa. Where's your clinic? Tell them where to find it.
Oh, I wish I worked for a holistic dentist, but I don't. Unfortunately, they are hard to find. There is a couple in my area. They are Scientologists, but there is one in West Chase, I think. Dr. Donica Brennan, she wrote the foreword for My Dentistry Made Easy. She's a biomimetic dentist in West Chase, which is Tampa, Florida. And I love what she does. She tries to preserve as much of the tooth as possible. And she doesn't like crowns. She will really try and save that tooth. She doesn't do root canals. So she will do everything she possibly can to preserve as much of your tooth structure.
Well, good. All right. Well, I'm going to share this one website here for you all that you just mentioned, I think. Holistic Dental Association. You get to come down here and search. Well, there you go. I guess you can search for wherever. Search by state, last name, whatever. Anyway, put your information in there. This is holistic dental.org. Find a holistic dentist. Yeah. There you go. Just plug it in. You can probably put a city, zip code, and you can find them in your area, which will be helpful because you keep getting fired.
I do.
So that's why you can't find her. It's okay. I keep getting challenged by boards and medical boards around the country trying to take away my license, which is why I just research all day long and then show up at events and teach you. But I actually, sold my practice in 2018 prior to the COVID scam. But anyway, very, very helpful. All right. So what other topics do you think or questions people should be ready to ask of dentists, either that they currently have and trust and want to continue using? What kind of questions should they be asking them to, be ready for a more healthy experience at a dentist?
That's a great question. So many times the whole airway thing is just completely ignored. And, sleep apnea, actually, I think over 20 million Americans have sleep apnea, but 80% of those are undiagnosed. And if you are not breathing, if you are not getting oxygen at night, that is a serious, serious problem. I mean, it's a strain on your cardiovascular system. If you're open mouth breathing and breathing through your mouth, what happens is that keeps your body in a state of fight or flight all night long. You can never get into parasympathetic rest or digest. And I hope people will start looking at their little children while they're sleeping. Is their mouth open? Because that is a big red flag. But unfortunately, dentists don't even really evaluate the airway. So one of the questions, should be, what is your stance on myofunctional therapy and airway related health? If they just give you a blank stare, then obviously they're not trained as they should be, because it's super important. If your child is open mouth breathing at night, chances are they're going to have attention deficit disorder. They're going to have like a bunch of other health issues. It affects their immune system. And then what's going to happen to their facial growth is their face will get longer like this instead of having that nice wide jaw. So that airway is compromised. And then, again, that's going to open them up to a lifetime of problems. And especially if they're breathing through that mouth all the time, guess what? They're going to have a million cavities. They're going to have, tartar issues because that's breathing, drying out all the tissue in the mouth. So if your airway is compromised, that is a very serious problem. And myofunctional therapy is kind of a new field, but it's basically physical therapy for the jaw, the tongue, and the face that can really help strengthen the muscles, because your tongue is a muscle. So if your tongue is on the floor of your mouth, it's called low tongue posture. That's going to create a crowded environment. Your teeth are going to be crowded. And sometimes people will go through braces 2-3 times and their teeth keep relapsing. And that's because your tongue. So understanding the importance of tongue posture and myofunctional therapy and the whole airway is really important.
Wonderful info. All right. So you got these 2 books. Now, if you see one that looks like this over here, but you saw Dentistry for Dummies, or Made for Dummies, it's got a different title. Dentistry Made Easy, The Great Tooth Deception. I recommend all of you get both of these because there's information you don't know about dentistry, just like you didn't know about the ICUs during COVID with remdesivir, the ventilation protocols, the sedation drugs that were actually causing people to die. I had to educate the world on that, bring the research forward. Then we have the book, right, Moving Beyond the COVID-19 Lies. And you, Heather, put together a collection of books. How many books do you have now?
3.
3 books. What's the third one?
Dorothy and the Tale of the Lost Tooth. It's a children's book.
Oh, very cute. All right. Can that be found on Amazon too? So remember, the books are not at HEB. You can find the mouthwash and the toothpaste there and other retailers. But the books, we definitely want you to be educated. And the more knowledge you have, the more information you have, the better questions you can ask, the more informed you are on the decisions you're going to make. And you won't have any regrets later when you find out, oh, I shouldn't have done that. One of the most insane things I remember realizing, I've never had a root canal in my entire life, but I've known family members who all did and patients who would come in. But when I learned about the fact that they just drill a hole in your tooth and kill the nerve and blood supply to this tooth, and then they leave that thing in your mouth.
Don't forget the bleach.
I used to say all the time, yeah, the bleach is one thing, but I just can't stand the idea that anybody believes there's a rational, common sense reason that we should leave a piece of rotting tissue in the face of a human. Like, embedded in your face, you have dead, necrotic, death, dying, black, turning tissue. Oh, but they put a pretty cap or crown on top of it. Oh, that's brilliant. Let's just cover up the necrotic tissue in there. How many of you have ever watched television shows where you're being programmed to trust surgeons and medical doctors in hospitals every single day in every single episode? And you will see that if there's a trauma or an infection in a bone or in a surgical situation or trauma, they will always say, just watch the shows. They'll tell you, we have to remove this part of the bone or this part of the leg. We have to amputate because it's necrotic. It is tissue that has died. We have to get it out of the body. This is going to wreak havoc on the entire body of this human. Mm-hmm. Okay. They'll cut out parts of your leg, parts of your knee, parts of bone that has infection in it that is dying, but they'll leave dead bone in your face called a root canal, and you don't expect anything bad to happen to you? Well, almost every single autoimmune patient I ever saw, I always wanted to know, did you have a root canal and which tooth and where is it still in there? And then I would tell them, it's time to go yank that thing. If it's actually correlated to their illness, I would say you need to go find somebody to pull out the root canal, the dead tooth, and consider putting in an implant if you want. I don't care, but get the dead tissue out of your face. And the bleach is another thing. It's horrible. You don't want the bleach in there too, but why would you leave anything in the body that is dead? That's weird. Even your gastroenterologist, if you're diagnosed with Crohn's disease, ulcerative colitis, they will actually cut out sections of your colon that they say have died. They're not going to leave it in there. They'll cut it out because they need dead tissue out. I find it absurd. You should too. And I find it ridiculous if you didn't know this. Welcome to the Dr. Ardis Show. All right, go ahead.
You brought up a point about implants. It's really important you not put titanium implants inside your jawbone because that is going to really mess you up. They are now finding that even with titanium joint replacements, it's causing a problem. Guess what? It's getting into your brain. I mean, it's floating pieces of metal going all throughout your body. So when you put that into your jawbone, it really affects your health. I am a proponent of zirconia. I have a zirconia implant myself. So zirconia is more of a natural material. So, unfortunately, the standard of care in dentistry is titanium, but so many women, especially, are allergic to nickel. And nickel is one of the ingredients actually in titanium. But do dentists ask if you have a metal allergy? No. So a lot of times they'll get failure and health problems, and it's because, they're allergic to something that they stuck in their body. So I would definitely recommend zirconia implants for sure as a replacement. But going back to, just the whole root canal thing and all of this is really wonderful propaganda because Edward Bernays actually was hired. He was like the first marketer, public relations person that Alcoa, which are like your aluminum
Company of America
and phosphate companies, hired him to get them to not have to bottle their hazardous waste because again that has to do with money, follow the money trail. And so what he did is he made fluoride be this wonderful thing through this whole marketing campaign of fluoride is good for you. And that's really where it came from, going all the way back to like the 30s and the 40s. I think they started fluoridating the water in 1945, and it's all about public, what the public is constantly hearing. And we've been hearing for over 65 years that fluoride is, God's greatest gift. But are you telling me in 65 years we haven't come up with something better? Of course we have. And something that you brought to light too with the whole venom thing, I was shocked to learn that they're actually trying synthetic venoms in dentistry because of their antimicrobial effects. So that's pretty terrifying.
Ask your doctor if venom's right for you. Every human being ever born just loves and gravitates to go pet venomous creatures. You see a snake, scorpion, even if you're 2 years old, what does the human condition say? Go pet that thing and hold it and cuddle with it. No, you have been wired by God to resist and run away from venomous creatures. Yet men all over the world are trying to figure out ways to convince you and manipulate you to believe that floor cleaner is good to rinse your mouth out with. And venoms from deadly creatures are a good idea to put in your body because they're antimicrobial. Let me explain something to you. They're also anti-human. If a snake bites you, it is in defense and it will kill you. The venom kills human beings. What do you think it's going to do to the microbes living in your body? It's deadly. Oh, did you know now that, speaking of oral health, did you know that there's a whole class, over 4,000 genetically modified seeds of our crops that we eat? The main assignee of the patents for this GMO seeds of all of our crops now for the last 25 years is owned by Monsanto. And did you know that all of these now have genetically modified venom proteins in the seeds to produce venom in the plant and in the vegetation, the leaf, stalk, bark, and the fruit of all of our crops? And they state that this is benefiting society because when pests come and try to eat the fruit or the leaves, because now there's venom in every part of the plant, the insect dies. So it helps us yield higher crops. Okay, Heather, the next question is this. Who are those crops being sold to? And they're putting it in their mouth. And you just heard about the oral connection to your bloodstream. Anything that goes in your mouth goes into your bloodstream and very quickly gets to the blood-brain barrier and can cross it. And they know all venoms do that. All venoms from scorpions, spiders, snakes, they paralyze their prey. They have to do that by getting past the blood-brain barrier. And that is the deadly toxic effects of venoms. So now let's add venom to our food supply, to our dental products and medicines. Oh, my goodness. Let's just expose, damage the blood-brain barrier, and allow more aluminum, mercury, fluoride to get into the brains of humans to create more dumb children and adults by lowering their IQ with these poisons. It's just ridiculous, and create more neurodegenerative diseases. Anyway, It's pretty ridiculous. You should watch my presentation called the Venom Industrial Complex, and we take you through all of it. Venoms in cosmetics. And you just mentioned earlier that cosmetics is how they got away with labeling toothpaste to be able to have fluoride and toxins in it to label it as a cosmetic. Yeah. Well, let's talk about fluoride in the water. We've discussed this all over the place. That started in the 1950s. It actually started within 5 years of Operation Paperclip, where we brought all these German scientists over here, and they actually educated our government agencies that they could actually put fluoride in the water of their captors in World War II, and you could dumb them down and make them more docile just by adding aluminum or fluoride to their water, which fluoride is a derivative of aluminum, everybody. And they would put it in the water supply to dumb these people down and get them to be more complacent and to follow orders. And then within 5 years of them being here is when the water systems were put into all the cities across the country, and fluoride started being added into our water. Thank you, Operation Paperclip. This is where it all comes from. You can just follow the history, the chronology, and the money. And yes, you will realize what the goal is. The ultimate goal is let's create as much disease as possible, much suffering as possible that we can profit off of from future surgeries, drugs being prescribed to you. And you haven't figured it out yet. Big Pharma owns the world. They own your governments. They own your politicians. And so anything that can create illness, disease that they can profit off from, they are sending those dollars back to their politicians to create regulations, bureaucracies, and put in laws and regulations and restrictions and access to all kinds of poisons to create these issues they can profit off from your suffering. So if you want to stop suffering, you might want to start with your mouth and your oral health. Stop eating the crops made with venoms in it. Stop putting drugs inside your mouth that may be venom-laced, synthetic snake venoms and other things. They do claim it's antimicrobial. It's anti-life, man. Venom kills life. So stupid. All right. It's dumb, in my opinion. All right.
Well,
Heather, go ahead.
What I was going to say about the fluoride, and especially for Christians out there, your pineal gland, it's your third eye. What fluoride does is it actually calcifies that. So it shuts down that spiritual connection that we're supposed to be having. So that's what fluoride does. You do not need fluoride. You don't need fluoride for strong teeth. It is absolutely something you can toss. You don't need it. And a lot of people are not even aware that the EPA was sued last year. And it was, they won in a federal court, proving that I think it was the EPA that was sued, and it was the Fluoride Action Network that sued them. The lawsuit started in 2017 and it just settled August 24th of last year. But they proved, scientific proof, this isn't conspiracy theory, that fluoride is a neurotoxin, that it is a mutagen, and there's really no safe limit of it. So, think about what it can do just even to your pineal gland. And there are ways that you can detoxify your pineal gland. I talk about some detoxification regimens that you can do in my book, just to kind of get that out of your system. Because, even if you have tea, fluoride is in tea. Fluoride is in so many of our foods because it's in the water. It's contaminated our food. It's really, really hard to get out. So I do encourage people to try and do some sort of a detoxification from fluoride, just so that, it really helps protect your pineal gland.
We've all been flooded and exposed to fluoride. We've got it into our body. I'm sure it's in the chemtrails. I'm sure it's in our water supply. It's in our foods and our dental products. They've been doing this for years, trying to poison us. All right, go get your books. Go get Heather's books. You need The Great Tooth Deception, and you got to read the Ford because I wrote it. It's freaking awesome. And then The Dentistry Made Easy, for you to understand the basics around dentistry, what to expect when you go to the dental office, because a third of you aren't going to the dentist because you're afraid of the dentist office. I got my own fears, man. I don't know why they haven't changed the sound of the drills. Like, why haven't they done that? Did you know that Ford Motor Company paid like $5 million for the ding you hear when you open the door to the car and shut it? Ding, ding. They paid $5 million to get that tone, and it's not annoying. I don't even know the Ford. I don't own any Fords. I just know they spent money to create a sound that was going to be more pleasant, not annoying to people. Why hasn't the dentist industry decided, let's create drills that don't freak everybody out with this horrific sound that we hear in every murdering show where the murderer's like sawing bone and, separating the body parts. That's what it sounds like when you go to the dental office. All right, maybe we should invent that next.
Try headphones.
Oh, there we go. Let's try some of these EMF producing headphones and ear pods everybody's wearing around the world. That'd be fun. Yeah. All right. So also show your products again. Mention your website where it can be found or purchased.
Okay, this is the spearmint line, which is for people that have more cavity issues. Again, the spearmint toothpaste. If you do have more the gum disease issues, I do have the mint or the cinnamon as well. But simplysilvermouthwash.com or Amazon. And if you are in the Texas area, I would love your support at HEB. But check it out.
And where do people follow you? Are you on social media?
I am. Instagram is Simply Silver Mouthwash. Same with Facebook. And I think TikTok is Heather the Hygienist.
Very good. I hope that's right. I don't know. You'll find her. Go find her. All right. Thank you for joining us today, Heather. Is there anything else you want to leave the audiences with or have come to mind that you don't want to leave the studio without telling them?
Well, again, I think just floss the teeth you want to keep.
All right. So I have a question. For you before you leave. All right. You got up and got on a flight at 3 a.m. to come fly here to Dallas to come join me in my home for this interview. I'd like to know, why are you so passionate about this? Why do you care?
Because if I had $1 for every single time I heard someone say, I wish I'd taken better care of my teeth. I wish I knew now what I, knew then what I knew now, I'd be so rich. And it's sad to me that so many people find themselves in situations where in order to have their mouth restored, they're looking at $40,000, $50,000, $60,000. And I really want to prevent that from happening. And, it's really an epidemic. I mean, if you look at what kills most Americans is cardiovascular disease and that direct relationship between your mouth and your heart. So I hope people will stop looking at the mouth as a compartment and consider it more as their whole body health and find the right provider.
When I go to the dentist, do you know what the first thing is they do? They actually take my blood pressure.
I do. Yeah.
Okay. So when she's just talking about there's a direct connection to the oral mouth and the heart, the cardiovascular system. Oh, your dentist knows there's a direct connection. In fact, they're being told every patient that comes in there, make sure you take their blood pressure. Yeah. Okay. Why would a dentist need to take your blood pressure? Your teeth don't pump blood, do they? I mean, maybe they do, but I thought the heart pumped the blood throughout your body. So why are we having to check the blood pressure? All right. There's a condition called endocarditis, and there's actually a direct connection to an infection underneath the teeth or letting that infection get worse through drilling or dental mishaps that can directly cause someone to die within minutes and cause their heart to stop. And it's called endocarditis. So there is a direct connection, and your dentist should know this. If you have excess high blood pressure that they notice when you come into their office and they for whatever reason, determine that you have an infection in your body, they will often send you away with an antibiotic and go, come back in a week. We can't do this right now. I've seen this. So they know there's a direct connection to the oral health of the mouth and the heart so much. In fact, they'll send you away with a prescription for antibiotics for a time period before you come back and then take your blood pressure again. There is a direct connection to the cardiovascular health in your chest and the teeth and oral health in your mouth. They all know it. And you sit in the dental chair and they do this to you and you've never wondered, why do you do this to me? They're checking your blood pressure because they want to make sure they're not going to be sued very soon for doing something that caused a very unfortunate death to occur or a risk of a heart attack or a stroke. And that's all correlated to your mouth. You just had no idea. So there's a lot you don't know. There's a lot I've had to learn over the years and study on my own and do my own research. And I'm very, very excited to introduce the audiences to these books, The Great Tooth Deception. Please go get it. And the things you know will actually prepare you how to best help your children, grandchildren, nephew, nieces, and all the conversations you have in the future. Dental health is important for all of us. Don't ignore it. Unless you don't like your breath smelling good and you don't like teeth that look healthy, and people still like you anyway. All right. So if you don't want to be attractive, you want to be less attractive, don't listen to Heather, the hygienist. Don't buy her books. And if you want to be a victim of chronic illness and autoimmune disease, ignore everything we just presented to you and don't read the books. But then don't, come to us looking for help later when we just showed you there's ways to learn this stuff and take steps each day in your home within a 5-minute, 10-minute period, twice a day to actually help you. Oh, how long should people brush their teeth for?
Well, 2 minutes at least twice a day. And flossing takes 1 minute and 1 second. So I'm like literally asking for 5 minutes of people's time.
If you ain't got 5 minutes, enjoy the misery of waiting in waiting rooms around the world for your prescriptions for your autoimmune disease later, when that 5 minutes you didn't have today turns into hours of waiting for your rheumatologist to give you your prescription. So now you can go down, drive into a CVS or Walgreens to get your prednisone and hydrocortisone for the suffering you have because you didn't take the 5 minutes each day to clean your mouth. All right. God bless you all. I'm Dr. Ardis. This is Heather, the hygienist. Say goodbye to the audiences.
Bye.
And good luck. You learned something amazing today. Your teeth actually poop in your mouth. And your mouth is basically a toilet, but it doesn't need to be cleaned with fluorine cleaning products like Listerine. God bless you all. We'll see you next week on the Dr. Ardis Show.
Disclaimer. Please note, the following presentation is solely for informational purposes and should not be seen as a replacement for advice provided by your physician. It is important not to rely on the information from this presentation for diagnosis, treatment, medication prescription, or any other form of medical care. Always consult with your physician or healthcare professionals before taking any medication, nutritional supplement, herbal remedy, homeopathic treatment, or pursuing any health-related procedure. If you have a medical condition or believe you might have one, promptly contact your healthcare provider. Do not disregard professional medical advice or delay seeking it based on this presentation's information as the products or services purchased from it do not establish a doctor-patient relationship between you and any affiliated physicians. Statements about dietary supplements have not been evaluated by the Food and Drug Administration and are not intended to diagnose, treat, cure, or prevent any disease.